So I think the pandemic, what we're finding now is that patients are far more complex than they were prior to the pandemic. And when I mean by complex, I think patients sat on their problems for far more. They maybe couldn't get into primary care, see their GPs. So what we're experiencing now is far more complexity, larger swelling, bigger wounds. The exudate has been there for much, much longer than it was prior to the pandemic. The other thing that we're experiencing is maybe staff who worked throughout the pandemic, their resilience is much less. And what I mean by that is, whereas before there was lots of goodwill, we were all happy to work extra time, always over, working over, now maybe we value our home time a little bit more because, work is work and maybe home life is home life. So that maybe the priorities are slightly different. I think during the pandemic, everybody's attitudes were, unless it was COVID, I'm not bothering any NHS health professional. However, they then sat on signs and symptoms that could indicate serious conditions and disease, and it's only now that they are coming forward, or when I say now, in the last year that they're coming forward, but they have sat on these problems for far longer than they would have had it not been for stay at home, wash your hands constantly, do not come in unless you have COVID. I think that is the problem. The other thing now, maybe we are dealing with a public that don't understand the backlog of what we're dealing with. So their expectations of the NHS is, why can't it be as it was before? I go to a GP surgery, it's half empty. Why isn't it full like it was before? But the rationale for that is there could be less GPs there, but also we're now doing new technology. We're doing virtual consultations, which don't necessarily mean that you've got to attend the GP surgery. You could just talk to the GP over the phone and resolve some of those issues. So I think expectations have changed as well.